welcome back to another episode of the Breast Cancer Physio. I'm your host, Jen McKenzie, lymphedema physiotherapist and ESSA-accredited exercise physiologist. In this episode, I've got my wonderful guest, Rhonda Jansen, with me, so thank you so much for coming in, Rhonda. Rhonda is a business mindset coach and clinical hypnotherapist, and we're going to be diving into the topic of how to get your mindset as optimal as possible while you're going through and following breast cancer treatment, because I think with all of my clinical experience in this space to date, Rhonda, the mindset of the patient is probably the one thing that's going to get them through as best as possible if they can get some control over it.
Yeah, I agree.
I know you've had your own lived experience of breast cancer though, so tell us a little bit about how your breast cancer journey went, but also how you got your mindset into a good enough place to get through.
It's hard because I'm going to give you a really brief description of my journey, and for anyone that's been through the journey or going through the journey, it's not as simple as I'm going to put it into today, but I'm going to, there's a lot more stuff in there, but I'm going to keep it really simple for the time that we've got. But I got diagnosed, I felt a lump in October 2019, and went and got all the tests done and ended up at Lisa Crichton's office, lovely Lisa Crichton, and she said, yep, it's breast cancer. And at that stage, I guess I was in denial, so I thought, no, it's not breast cancer. That confirmed it for me. So that was upsetting, but my husband was sitting next to me and had to go and lie on Lisa's lounge in reception because my husband had been diagnosed with stage 4 bowel cancer 2 months beforehand, and he was really sick from chemo. So when Lisa talked about the lumpectomy, I thought, yep, great, I'm going to have a lumpectomy, it's all going to go, that's it, it's done, bang, 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 bang. Went and had the lumpectomy and went back and saw Lisa, and unfortunately the lump that I felt was 78 millimetres. So it was quite big.
That's a big lump, yeah.
It's a big lump. That's the one that I could actually feel. Lisa found 3 more lumps. One was 4.5 millimetres, 2 point, anyhow, there was 2, she found more in there. And I was upset because I thought that lumpectomy meant, great, it's all gone. And then she said, this is what's going to be happening. I got referred to lovely Michelle Morris, the oncologist, and started the chemo journey. And that, I think, was the hardest part, is my husband would go through chemo 1 week, and he was so sick, he had the bottle in, and he was so sick, telling my boys that they, it was their stepdad, but my husband had bowel cancer. They saw how sick he was. To go home and tell my boys that then I had breast cancer,
that would have been a very tough period for them.
Really hard for the boys. And so the chemo journey was, and for women that have been through it, or even men that have been through it, losing my hair. I had long dark hair, and I can remember when it came out in clumps, just crying that my hair was falling out. I mean, how vain in hindsight.
It's funny though, isn't it? Because so many women will actually tell me that exact story, and that's always the response, is that they think they're really vain, but I think it's actually quite natural for us to all be a bit vain. I don't actually necessarily think there's a big problem with vanity, but it always seems to be that's one of the moments that really hits you the hardest.
Yes.
Yeah.
Because I think what hit me is, I only told people who I wanted to tell that I had breast cancer.
Yeah.
That's all I wanted to tell. All of a sudden, if a man's bald, that's okay for a man to be bald, but when a woman's bald, automatically she's got breast cancer, and all of a sudden my life was no longer private. And that's what I struggled with. I didn't like...
Yeah, it was public view. Yeah,
it was on public view, and I like to keep a lot of things private. So I can remember my husband taking me to his barber, and the barber was shaving my head and crying and crying and crying. But then when he finished, we went to a coffee shop, Mark and I, and we both laughed. And there's a photo of me smiling, which I'm so glad Mark took it, because we're both. Mark said, "Who would have thought we'd have this end up with the same hairstyles?" And I had to laugh. Like, I thought, "Oh my God, we've got the same hairstyles." So for me, it was keeping my mindset strong, like supporting my husband through his cancer journey and also my cancer journey. And, you know, I talk about mindset all the time. And like you said, I've been a mindset coach for 20 years and I do hypnotherapy as well. And I know how important our mind is in our daily lives, but just not when we're sick, but in our daily lives, our attitude and the importance our mindset plays in our daily life. And I would listen to my mentor for my hypnotherapy, gave me recordings for hypnotherapy, and I'd be in my chemo chair, and the cold chemo would be going through, and I'd be listening to the hypnotherapy recordings about, you know, relaxing and visualising the chemo going. And don't get me wrong, I'm a huge believer in modern medicine. You know, I don't think, you know, if we could just wish cancer away, that would be nice. Brilliant. But it was about keeping my mind in a good place and a strong place.
It's interesting you say that, actually, because I have got patients who are fairly against, you know, Western medicine techniques. And, you know, each to their own. But interestingly, a lady who comes to mind recently who we actually sent her off to a medical oncologist for a second opinion so that he could give her just more information around what the chemotherapy was trying to do, what it was trying to achieve, what it wasn't trying to achieve. And even though she doesn't really want to do chemotherapy, she's more at peace with the decision to do chemotherapy because she's more informed now. And it was really interesting watching her mindset change, because initially it was like, I'm not going to do that, because she's always been, you know, anti-Western medicine. Ultimately, she was so much more at peace to be able to go forward with that treatment technique just because of the mindset change. So medicine changed, only the mindset was changed. Yeah.
Isn't that interesting? Because I've had so many people give me an opinion about my breast cancer journey. And I never even asked them for their opinion, but they would be happy to give me their opinion. And I thought, I didn't even ask for it.
Yeah.
And then I thought, when you go through that journey, I'd say to them, you know, that's certainly your choice, but this is my decision. It's my body. The worst thing I did was Google. I would Google stuff that was the worst thing. And I think it's like anything. Google can be a bad thing. I listened to my specialists.
Yes.
I listen to my specialists.
And certainly one of the things my followers will definitely realise this by now, but I harp on often about that one of the best ways you can get through breast cancer is to have a really great medical team around you. But unfortunately, not everyone has the choice of who they get to see or the ability to change if they're not happy with one person. But at the end of the day, that what I'm saying I think is still factual. It's like if you have bad rapport with medical professionals, or if you have great rapport and a really supportive team, that can dictate how your journey goes.
I agree.
But at the end of the day, at least what we're talking about today is completely in control of the patient to a large degree, because it's their mindset.
Yeah, it is. And I think I certainly know my husband Mark got to a point that he felt like he wasn't in control of anything anymore. And being, you know, a husband and a really good successful business owner, he was always in control of and able to fix things. And he felt like all the power was given away to him and he had control over nothing.
Yeah.
And you're absolutely right, I trusted my medical team to cover that base. And they did. And I just had to worry about my mind. And I found by making sure that I only surrounded myself by positive people, I wasn't seeing, you know, a lot of people. I only focused on seeing positive people. I had a really huge support network around me. I don't believe we can get through it without a really strong network. I had friends with a roster of cooking food for us. And cooking food for us and just positive stuff around me. And I'm not saying, don't get me wrong, there was days that I would just cry and cry. And I would cry, I'd be fearful, I would go through all the emotions in one sentence. Like I was talking to you, I'd go through every single emotion in one sentence, but I know not to get stuck in emotion.
Yeah, and I suppose that's a really good point to bring up, is that it's still okay to have days where you are down, you're grieving, you're processing your emotions, because even though people would consider that a negative mindset, and I'm sure you copped the old phrase of, oh, just think positive, and it's like, oh, you can't really think positive all the time. It's just not natural.
I don't think it's natural. I don't think we're innately born to do that.
Yeah. If you can go through multiple emotions in a day where you don't have breast cancer, then you're probably allowed to go through some dips when you do. So when you were grieving per se, what did you allow yourself to do? Did you have boundaries that you set as to, like, okay, I'm only going to stay in here for as long as I should, or did you actually allow it to flow?
When I was going through the treatment, do you mean?
Yeah, when you were really upset about your treatment.
I would just allow, because I think it was good for my boys too to see, they're 14 and 17, so at the time, what were they, 13 or 12, or whatever, they're 14 and 17 now, it was good for them to see that I am sad, I am sad, I am whatever. It was good to them to know that that's a normal thing, but I would just have a cry and then think, okay, I need to move on. I know not to sit in that energy. I knew that, I just know from time just to move on. It's okay next. I've also learnt if I keep my mind thinking about something, about distracted, if I focused on it, would only make it worse. I'd need to focus on something else, and also doing something physical with my hands. And I'd go outside. The garden's not this way now, but I'd pull out so many weeds, because I'd just go outside and pull out a weed. It was something physical.
Yeah, absolutely.
And it would shift my energy.
It's interesting because I suppose one of the things I definitely harp on about is the role of exercise for mental health.
Huge.
But if you break it down, it's really what it does to your mindset, as far as if you're having a really flat day through chemotherapy, you might not necessarily be really sick, but you might just be low on energy, and that's actually one of the best days you can potentially go and do exercise, because it lifts your energy levels. But if you get better energy, your mindset changes, because I honestly think this is the wrath of being a female. You're either sleep deprived from breastfeeding children or looking after children, or you're going through breast cancer treatment or menopause, you're being a female. So I think exercise is such a vital thing for females as we go through the years, because of the influence on our mental health, but specifically on our mindset. So exercise has always been a really big part of your life, but it must have become a bigger part off the back of what you've gone through.
I was always at the gym 2 to 3 times a week. After my second chemo, I couldn't gym anymore. I just was so sick. The first 2 months was I don't know the technical name of it, but it was it's really strong chemo.
The AC.
Is that what it is? The Red Devil. Lost my hair. Thank God the chemo nurses said, go get your eyebrows tattooed. I'm so glad I did.
Yeah, right.
Because losing my hair, eyelashes, everything. There was days I didn't feel sick, but then I'd go in the mirror.
Look in the mirror.
And I'd go, oh, that's right. So always huge on fitness, and I went in with a really strong body, so I was really fortunate, and I believe all my years of going to the gym helped with my double mastectomy, which we can talk about in a minute. But there was days like they were saying, go for a walk or do these things, and I thought, they're bloody kidding, aren't they? Like, I feel so sick, they're kidding. But it was the best thing, because I'd only walk a little bit. I find water relaxing, and so I'd go down to Golden Beach, walk along there. Even if it was only a little bit, I was still physically outside, and it did switch. It did
change your mindset.
It changed my mindset instantly.
It is amazing, because I think if we compare active treatment to a lot of women that I look after in the aftermath of breast cancer, and there's a lot of women where I can see they are stuck in a mental rut. And it's interesting talking about this comparison between when you've got to get through things like really bad chemotherapy days, but I think what can be even more chronic is this rut that people get themselves into, because that can drag on for a really long time in the aftermath of breast cancer, where they just can't bring themselves to do what they probably know is going to benefit them, like exercise, or whether it's counselling or physiotherapy or joining a support group or whatever, but their ability to crack that mould of this almost like post-treatment depression, it's quite stark. I see that often.
Wow.
Yeah.
And that's after their treatment is finished?
Yeah. After their treatment can be way more profound, because I think there's so much support for women going through breast cancer treatment from medical professionals, including their nursing staff. The oncology nurses get the biggest rap from their patients all the time. But of course, amazing. They are amazing women and men, aren't they? Like, honestly, the role they play is quintessential. But interestingly, that group of people disappear as soon as the last radiation session is done for a lot of women, or last chemotherapy session, and that it seems to be where females will, some will dip into this sort of what can become a chronic mental state of, I don't know what you'd actually call it, whether it's a mix of depression, anxiety, or just a general feeling of being lost. Yeah. So and would that's you the state of mind that So would you have anything strategic wise that you could, if you had that group of people sitting in front of you, like from a strategy point of view, what would you suggest they could do to break that rut?
It's a really good question, because I always use the analogy with the mindset is we all have emotions and it's normal. We are emotional beings and we need to express emotion. Have you ever met people that have no emotion?
Yes, very hard to read.
It is, isn't it? But I don't think we all have emotion, and there's some people that haven't let go of the emotion, whether it be grief or whatever it is. If I had those people in front of me, I use the analogy with our mind is like, and I might have said this to you before, an old manual car. Have I used this with you? You know the old, not the ones nowadays because they're pretty fancy, but when I got my licence, Jen, the old manual, they were like, and if it got stuck in gear, like, and the car's struggling. Yeah. The car will keep driving, but it's stuck and it's struggling and it's, and then we want to get it. And once we get it shift it into another gear, the car goes along more smoothly and the ride's more smooth. People think they're staying the same, but we're not actually. When we're doing that, we're like that manual car and we're stuck in gear. People, if they stay in that, they're actually not staying the same. They're actually going backwards. Yeah. So when people say to me, "Oh, everything, it stays the same," no, it's not. We're going backwards. Really have to recommend a really quick answer to that, and I can bang on really easy, Jen, as you probably noticed. A really quick answer to that is ask someone that you trust and value their opinion, not someone that will give you an opinion because, sometimes family aren't the right people to ask. Don't know how to say that. Sometimes family aren't the right people to ask. But actually saying, do you think I'm stuck? Yeah. Do you think my mindset, I'm stuck? Ask someone that will be honest with you and with courtesy and ask them. It's a good. I love the analogy of the gear box being stuck, and it is interesting because I have had plenty of examples actually where sometimes the most trusted person in the medical team for the patient is actually, say, the breast surgeon. I think that sometimes happens, certainly on the Sunshine Coast. We've got some fantastic female breast surgeons, and I think it's wonderful for women to be able to go to a female surgeon. Nothing offence to the guys out there, but at the end of the day, it's wonderful for women to be able to talk to female specialists. And I think because that breast surgeon is such an important first role, sometimes the trust element is really built up there. Yes. Patients will sometimes return to that breast surgeon going, what is wrong with me? And that's often where some of the breast surgeons will start referring to physiotherapy, counselling, support groups, and that's when the ball gets rolling. So it's like you said, the trusted person sometimes is not best a family member or a friend if they've never had much experience with breast cancer. And again, it comes back to this, the better your medical team, I agree. Typically the better you get through. Yeah. And, some people say just deal with it. Just deal with it. And I'm sure, your viewers have said that. Just deal with it or get over it. It's time to move on. Yeah, really? Absolutely. If it was that easy... Everyone would do it. Everyone would do it. Yeah. Everyone would do it, and it's not that easy because our mind, after a certain way of thinking, our mind gets set in that pattern. And you think of a river, water going down a river, it gets set. So it's about how do I create, how do I become aware of my triggers and my thoughts, and what's my strategy that I'm going to switch, and like a circuit breaker. I call it a circuit breaker. So how am I going to switch that thought? How am I going to switch it? I think sometimes people benefit from having like a location, a trusted location, trusted person to go to that is very formally set for them. So as an example, and I think this
this all comes back to the mindset of feeling comfortable. So if, say, we get diagnosed with breast cancer and you're with your general practitioner or you're at breast screen, you know, as an example in Australia, you know, that process of the point that you get diagnosed, you are then sent to a trusted surgeon, whether it's in the public system or the private system. You are then forwarded to a medical oncologist. You are then recommended a radiation oncologist, and so on and so forth, whoever you need in that team. So there's all of this. There's a comfort factor in the sense that you know, you're being organised by someone else.
Yes.
And I think this is where I come back to the same thing again, where after that last radiation session, there's a lot of lost in the woods, like feeling built up. So, which is where, say, at our clinic, we've developed the Thrivership strength classes for women to attend. If some women come in and I catch them at the right moment and they're in this mental rut, but then I can say to them, hey, there's a you know, a specific breast cancer strength class, you could come here, try the first class for free, blah, blah, blah. Sometimes that female will go, that's exactly what I need. Or it might be the support group that we can refer them to. But without anything formalised, that's where it can sometimes maybe get tricky, because the patient's like, well, I've got to work this all out myself, and I'm the rookie here. So my mindset is, I'm lost in the woods. How do I get out of this wood? You know, so if that makes sense. And it's the mind that will control all that. Like the mind, you know, you think about, you know, if we lose, which, you know, our breaths, our body keeps going. Our mind is what tells us all to move that arm or move that arm. Like you said, it's up here. And we've had this discussion before, you know, after, and it's just such amazing, the medical support and all the medical people and professionals. But after that, it's which I wasn't aware of, Jen, until I met you. Thank God I met you. Right. There's, you know, you think there's really stage one, and then there's stage two.
Absolutely.
And stage two is like all this mist. There's this fog, and you don't know. Yeah, it's like you're searching in the dark. Again, I haven't had a lived experience of breast cancer, of course, but I probably come across like I do sometimes. But I'm only speaking on behalf of my patient experiences. And what's interesting is that people can search and search and search, but until they find their niche, like if they need a support group, if they need a counsellor, if they need a physio, they will be stumbling for quite a while, and you can see that their confidence levels are really rocky until they get each individual issue sorted. One of the things that always strikes me is that it's a lot of hard work for the patient. Like, just because you
in stage two, do you mean?
Absolutely. It's phenomenal because you know, you can't stop at your last radiation session and expect everything to be rosy. And I think, ironically, at the end of that last session, you're bloody exhausted.
Yes.
You don't often have this mental energy to be like, okay, what's on the list? Oh, I've got to go tick that physio box. I'm going to go to the gym and drink that green smoothie. You're stuffed, you know.
It is,
and so, you know, I have conversations with patients like, oh, have we done your lymphedema index score? And are you exercising? You can just see they're just like, no. And they know what they should do. It's not that the female doesn't want to do that, or the man. I should also include our male breast cancer patients here, so apologies. They know what they should do. It's this mindset where they really are partially exhausted physically and emotionally, but then making that leap to go, well, I need to start something here. I need to do the circuit breaker, like you said.
And it's a circuit breaker. And that's one thing that I do with the hypnotherapy is, how do I go in? How do I get people in a relaxed state that they can do that? Because like I said, if it was that easy, everyone would be out there.
Absolutely.
And they wouldn't need all this stage two. But it's not our human innate, we're not innately born to do that or think like that. So how do I get into that state? How do I get help to go and exercise or eat better?
Yes,
eat better.
Diet's a great one, isn't it? Because again, it's actually a hell of a lot of work to eat healthily, be organised with your shopping list and all that sort of stuff, to actually have a really clean diet, which we all should be aiming for anyway, but even more so after breast cancer. That's a huge effort to do that. What strategies what were your go-tos in the aftermath of Mark passing, where you felt you could really climb up the mountain again? Because that must have been a real rock bottom phase for you.
Yeah.
Did you feel it was rock bottom or not necessarily?
Oh, it was hard because my boys saw Mike pass from cancer.
Yeah.
So then my boys have gone and they could see how sick I was.
Yeah,
so my
right.
boys
So
are like, oh my God.
Mm.
Every time I'd make a move or whatever, it was like, Mum, are you okay?
Yeah.
I was really fortunate, and I've said it before, is the importance of community and people helping us, but get the right people. My mum moved down from Port Douglas.
Yes.
And she moved in, really fortunate. My youngest sister broke up with her partner, so she moved in. And so I didn't have to worry about cooking or cleaning an iron or anything. I just had to work on healing. And I think that's a huge thing. So strategies is having people around to help. That all I had to worry about was me healing.
Yes.
I could sleep as much as I want. The boys were gotten taken to school and picked up. They could go to their sport. Groceries was done, cooking, ironing, everything was done. I just had to focus on my healing. So went back to, because I'm a hypnotherapist as well, I went back to listening to recordings and being calm and listening to recordings of visualizing my body healing. I'm healing, I'm strong, I'm nurturing my body with healthy food.
And exercise, obviously.
And exercise, I couldn't go back to the gym. I didn't start back at the gym until the beginning of this year, but certainly walking. And walking to me mentally, and I know we hear it all the time, but walking outside in nature does it.
It's so underestimated, isn't it?
Huge from my mindset. It's huge. And water for me, walking along water. So that was my strategy. I knew I needed people around me, but all I had to worry about was healing and going to my appointments.
And I suppose there's a lot of people out there that may not be as fortunate as that to have that help around you. But I'll tell you what, there's a really good take-home message there, which is that if somebody offers you help, take it. Because I think by nature, women are not fantastic at accepting help when they're so used to doing everything for everyone else. You know, our DNA is so set towards, we look after our children and our snoring dogs and husbands. She's really getting the Z's that he goes. And, you know, aging parents, neighbours, our house, our job. So one of the really, it's funny but not funny things that I see throughout breast cancer all the time is the female will come in and report symptoms and she'll say, oh, sorry, I'm sounding like I'm whinging. And it's like, sweetheart, you've got breast cancer. You're allowed to report any symptom you want. So, take home message here, guys, is accept help if it's around.
Huge.
Because not everyone's fortunate enough to have help around. And then on the other flip side of that, like you also said a while back, you know, sometimes the help that's offered isn't necessarily beneficial, and it's really tricky then to sort of have to tell that person that's actually not helpful. So.
And I think too, I mean, this could be a whole other
video
was on how to help. You know, that's a whole other one on. From my perspective on how to help.
Yes.
But that's a whole other thing. So, and again, I'm not saying I didn't go through sadness. I think you know, people go, did you go through anger? No. What's there to be angry about? But the sadness, I can remember I didn't make it until when Mark passed. I got the phone call and I said, Mark's passing. You know, coming and nearly collapsing at the hospital or the palliative care when I got there. But coming home and just crying because I could see his clothes in the walk-in wardrobe and the shoes and realising it, and I still cry. But it's moving past that. I knew I had to mentally do everything mentally to keep my mind healthy. So whatever the strategy is, whether it be listening to music, I said come in here listening to music that makes you feel happy, meditation music, bumpy music and bumpy music, that sounds really old-fashioned, doesn't it? You know, music that gets you going, or only spending time with people that are positive and aren't dwelling in the negative.
Indeed. Interestingly, just jumping back to the acceptance of help where it can actually be not the most beneficial for you. A lot of my patients will tell me that the husband's heart's in the right place when he goes to do this, or the partner's heart's in the right place when they go to do this. They'll be like a helicopter parent, and it's like if you sneeze, they're like, "Are you okay?" And at the end of the day, so many women, and I'm sure men, who go through breast cancer, they just want to feel capable and independent, because that's actually what makes us feel good. And when it comes to mindset, if a female or a male going through breast cancer can go and hang the clothes on the line or cook, you know, a little bit of a meal or whatnot, that actually makes you feel normal. And so if you're doing normal activities, your mindset is you're not a sick person.
I agree. So, I absolutely agree.
Yeah, I think that's a really interesting thing that, and that would be a great video topic to cover. How other people can help with that's more beneficial to the patient. We could go through a few.
That's another thing as well. I've got 4 wigs. 4 wigs. Luckily, I was given 2 and bought 2 more on impulse. I wouldn't recommend going and getting 4 wigs. But I was wearing a wig, and people go, "You don't need a wig. You don't need a wig." I feel when I go out, I feel good that I've got hair, and I went out a lot of times without no hair, but I want to look in the mirror and it makes me feel good. I'm going to wear a wig because it makes me feel good. It might make you feel uncomfortable, but it makes me feel good. So things like having a wig or getting your makeup done, or whatever it is. And that's one thing I can say is that, you know, talking from Mark's experience and mine, is we're not in control of anything. Well, we are. We actually are. We are in control of it. But all the medical team, it's great. Thank God for them. But we're in control of our thoughts.
Absolutely.
We are 100% control of our thoughts. And that's important.
Absolutely, yeah. And I think it's interesting talking about the physical or the aesthetics essentially of what you see in the mirror, because I liken it a little bit to someone who's been put in jail. It's sort of like being institutionalised. If you've lost your hair, you are a cancer patient. You're sort of labelled, whether you like it or not.
And they start straight away, oh, got cancer.
Yeah, absolutely, yeah. Like I know there's plenty of my patients who will choose to wear a cap over something that is more closely associated with cancer because they don't necessarily want to be identified as a cancer patient. And again, that's fine. It's like it's each their own, because a lot of women also get judged for breast reconstruction. You know, I think a lot of people who haven't experienced breast cancer are very quick to judge a female who's had a breast recon. They're sort of very confused. And I suppose from that other side of the table, it could be understandably confused as to why a female wants breasts back when they just tried to kill her. But at the end of the day, you know, it's what makes you feel good. It's what puts your mind in a positive place.
Yeah, I agree. Yeah, because the first thing, and I can't stress this enough, the first thing that happens as human beings, we have a thought. The second thing is we have a feeling, and then there's an action. Always. It doesn't matter what it is that we're doing in our daily lives. First thing is we have is a thought. Then there's, and I want you to think of, we were talking about something earlier when I got here. The first thing you had was a thought. Is that correct?
Yes.
Then you had a feeling.
Yes.
And then there was, you would have normally have done an action. But So it doesn't matter what we do, the power of thought. And again, I'm not saying I'm going to sit here and go, I'm going to sit here and Jen and I are going to lose weight, we're going to think positive, we're going to think positive, we're going to lose weight. Because Jen, that's not going to work, is it? We've got to get our asses in the gym. But always, and think of this, and this is the most important thing that I can say from today. First thing is we have a thought. Second thing, within seconds, is a feeling. That feeling will determine our action or inaction. And you said before, if there's women there that they're stuck in not taking action on anything, or they're sitting in depression or sadness or whatever it is, it's because of that thought. They're not taking action based on that thought, so that thought's created a feeling that they're not taking. So once we change that thought, those people, men and women, will then change their action.
Yes, yeah.
So it's understanding what's that thought that's creating that.
Yeah, absolutely, yeah. I like that, because at the end of the day, I think that reassures people, at least who are in this space where they can't seem to get going, that it does come back to, it's not that they don't want to do it, it's that they really cannot change that mindset to then be able to go forward to do that. So,
but we can change the mindset.
Yeah. Oh, sorry, they can't change it at the moment.
At the moment, because they don't know how to. And you know, and I say this all the time to my clients. We don't self-sabotage ourselves deliberately as human beings. We don't deliberately, honestly. Sometimes you've got to look at people and think that they are, but we don't walk around self-sabotaging ourselves every day. We do it unconsciously, because if we knew how to fix it, we would. But what's that thought? And that's the first question. Why am I thinking that? What's the thought that I've got in my head? Why am I thinking that? Is that a belief that I grew up with as a kid? Is that still relevant? You know, it's the thoughts that we have.
So as a clinical hypnotherapist and mindset coach, that's really your role, isn't it? It's to help people do the circuit breaker technique and really, I suppose, assess how they're thinking about something, but then also allow them the ability to manipulate, or not manipulate, it's a really bad word, isn't it? Mobilise those thoughts into something more positive and progressive.
I actually like the word manipulate. I'm going to use that, Jen. Thank you. Because I'm going to use that. We are manipulating that thought. Because have you ever changed your mind on something?
Absolutely.
Yes. And how quickly did you change your mind?
At times very quickly.
Like that. We can change our minds, especially women, really quickly, can't we? We can change our minds so quickly. And it's that quick. We can change it that quick. So it's about, when we're relaxed, it's about, okay, how do I change my mind that quickly? So that's what I do, is I help people. Okay, what is it? What's that thought that you've got there? When did you first get that thought? What makes you think that thought was still successful? How can we change that thought? Also, getting people, how do you want to think?
Yeah, I think that's a wonderful phrase. I think it's a really nice thing. It's like, in the same way that I'm like always harping on about women creating version 2.0 of themselves after breast
you said that to me. I like that.
I just hate the phrase new normal unless it's applied to, say, a situation where it's like, yes, okay, I've lost a breast and I'm not getting a breast reconstruction. My new normal is that I have one breast. That's okay, because that's factual. New normals on topics which, such as mindset or energy levels or muscle mass or bone stock or brain cognition or whatever, like the idea that these things are set in concrete after breast cancer is just dangerous as far as I'm concerned for the patient, because if they are put in this position where they think, oh, I can't change this, where's the motivation going to come from to try and manipulate the situation?
But I absolutely agree 100%. 100%. And you know, it's that self-talk, you know, the self-fulfilling prophecy. That's exactly that. That's self-fulfilling prophecy. You know, I can't do it. Well, if you think you can't do it, you can't.
Correct.
And I love, you said that to me too, and I like that version too. Version 2.
I think if there's ever a time in a woman's life where they can stop and take stock of things, I hope it would be something as serious as breast cancer. And that they've got an opportune moment to sort of go, what do I want my life to look like? You know, because I think we don't know everything about breast cancer and how it starts and why it starts, but certainly there's elements we know contribute to cancer, things like being overweight or alcohol or smoking or even stress levels, you know, and I think there's, it's just a really good time in a woman's life or a man's life to really go, how can I change this environment and come out a better person on the other side? So.
And I think that's the really important thing, is how do I want to be? You know, how do I want to be at the end of it? So someone might come to me and say, I just want to feel calm through my treatment or after their treatment. I just want to feel calm. And also I'll say to them, what thoughts do you want to think? Or I ask them first their feelings. I want to feel calm, or I want to feel reassured. I want to feel that I'm going to be okay. Okay, let's just work on, it's real simple stuff. Okay, so what thoughts would you have to think? And then through hypnotherapy, they're allowed to just, that circuit breaker, change that thought. Is how do you want to feel?
Yeah, absolutely.
I want to feel it's okay.
Yeah, I love that, because it's really acknowledging like the position of the patient as opposed to my role as a health professional is often sort of drumming information into people, and you can see the poor patient sitting there going, right, I'm going to remember all this stuff and listen to it. But at the end of the day, to actually really dive deep into like, what do you want to get out of this from your end of the spectrum is, I really like that. I probably should start using that with a few more people in my clinic.
And it's got to be client focused, because, you know, I heard someone say that, and I might have said to you, you know, empowerment. And I'm thinking, that's not for everyone. Not for everyone. I want it to feel okay. I want it to feel calm and a calmness through my journey.
I had a lady in my office just the other day actually, and she was very keen to know what she was going to look like, not physically necessarily, but just what was her person going to be on the other end of this road. And it was a really interesting sort of question. I don't think actually anyone's ever pitched that to me before.
That is so powerful.
But it was a really fascinating sort of seat for me to be sitting in, because I suppose I've got this massive benefit where I can say to her, you're going to be okay, you know, but for her to hear that, you know, that might not resonate enough. So we were going through all the side effects of chemotherapy and radiation, and we've
So she hasn't started the journey yet?
She's just about to start,
okay.
yeah, and she's got a pretty big road ahead of her, you know, and we were going through side effects of all of the different therapies or treatment regimes and sort of breaking them into acute versus chronic. And really, at the end of the day, there's not, ironically, there's not a huge amount of chronic issue. If you deal with your physical elements, it's all back to this. It's quite amazing, because I'd never done that with a patient before, and when I had this experience, I was like, wow, if you break it down, apart from a couple of scars, maybe some radiation, fibrosis, peripheral neuropathy is definitely a nasty long-term effect. But if you look at things like fatigue and muscle mass and bone stock and anything mental, that is manipulatable, and that's an exciting thought, because that is stuff that is in our control.
Yes, it is.
And usually when people find out what's in their control, they feel calmer because that's at their fingertips.
Yes, and I think that's an important thing too, is in our control, our ability to manage. How can we manage this situation?
Absolutely.
I love that though. How did she want to... So it can be whatever she wants it to be.
Yeah, I suppose it could have, but from her perspective, you could see that there was a large amount of fear. It was like, who is this person going to turn into at the other end of this journey? What am I going to be left with? And I
do you mean physically, visually?
Well, no, everything.
Okay,
you know,
so everything.
Yeah, it was mental, it was physical, it was emotional. You could see that it was this very big question, you know, and at the end of the day, I just thought to myself, gosh, like, if you could give someone a crystal ball and show them that they're going to be okay on the other side of this experience, if anything, you know, if before I leave the planet, the one thing I'd love to achieve is that women know they're actually going to be stronger on the other end of breast cancer, which is not really the commonality at the moment. It's sort of like, I think this lady thought she was going to be like a carcass of herself at the end of the experience.
And that's a really big visual, do you know what I mean? And when you say that, because I'm highly visual, is when you say that, I'm thinking that's a really fear. You know, there's that thought.
Yep.
Then there's that feeling.
Yep.
So she had the thought of this is what I'm going to look like.
Yes.
And then that came that feeling of fear. So see how there's that thought, feeling, action. And that's one thing I love too now with breast cancer. You know, I had to have a double mastectomy after all my radiation and a double mastectomy, but they used my belly. I forget the technical word.
The diet flat reconstruction, yes.
Which I don't like that word, because nothing's flapping. We have
spoken about this before,
I don't like that word. But I could have had not done that. I could have had tattoos done. And I love that we've got choices.
Yes.
And it depends on how we feel and what we want, and I love that there's that choice there too.
Absolutely, yeah. Very lucky to live in this part of the world to have that kind of choice, because there will be plenty of people watching this video that may not have the amount of choice we've got in the first world countries as far as breast cancer treatment and breast reconstruction is concerned. But at the end of the day, anything that is within our control, which is actually quite a bit, as long as people have access to the information and you know, all of that is there's a lot there you can grab hold of. That might be a good place to stop, man. That was a pretty epic video.
I wonder if you actually got it all.
We may not have got all of this, but that's all right. Thank God for editing. Thank you very much, Rhonda Jansen, for joining me today. I'm sure we will get Rhonda back. As you can see, Rhonda's had a pretty full-blown lived experience of breast cancer and some other major life events that have really shaped her experience. So we will be back next week with another video, guys. So thank you very much for watching. I hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and we'll see you next time.